This is an ultrasound of a young boy presented to us with the history of pain in the right iliac fossa, fever, vomiting, and tenderness. There was a thick-walled aperistaltic gut loop noted in the right iliac fossa, and this was diagnosed as the case of acute appendicitis, as you can see on the gray scale as well as on the color ultrasound. Now I will discuss the stages of the appendicitis. There are four stages of appendicitis. The first stage is the early inflammation. In early inflammation, only the appendix is inflamed while the flow is intact in the walls, and the peristalsis are usually absent. The second stage is the suppurative appendicitis, in which the inflammation progressed to the acute suppurative appendicitis, and the appendix lumen is filled with the fluid. However, the lumen is intact, but due to the excessive filling of the lumen, this will convert into the third stage, which is called as the gangrenous appendix, in which the tissue starts to die due to the excessive pressure on the walls. This pressure causes the lack of flow of the walls, and the tissue will die. And ultimately, it will convert it to the fourth stage, which is called as the perforated appendix, in which the gangrenous appendix ruptures, and the spilling of the infectious content into the abdominal cavity. So these are the four stages of appendicitis. We can simply discuss these stages in this picture. The normal appendix is usually smooth in the contours, and when the obstruction is occurred in the mucosa, the fluid will be filled within the lumen of the appendix, and the high intraluminal pressure will cause temporarily ischemia. This ischemia will cause the necrosis of the appendix wall, and ultimately this the gangrenous appendix will lead to the rupture and perforation of the appendix. The first line diagnostic tool is the ultrasound. So the typical appearance of the acute inflamed appendix on the ultrasound is that the usually aperistaltic gut loop is noted in the right iliac fossa, and it is blind ended sausage like, and the diameter is usually more than 6 mm, but can be varies from the 6 to 25 mm. The commonest cause in the acute appendicitis is usually intraluminal fecolith, which causes the obstruction of the lumen and lead to the acute appendicitis. Appendix is usually seen in constant location in the right iliac fossa, but if it is retrocecal in location, it would be difficult to diagnose on the ultrasound. So, what are the difference between the normal and inflamed appendix? The normal appendix usually visualized in less than 30% of the cases, while the inflamed appendix can be seen within 80 to 90% in the cases, and the normal appendix usually less than 6 mm in diameter, while the inflamed appendix is more than 7 mm. And the normal appendix usually compressible, and inflammation is never seen around the appendix, while in the inflamed appendix, the appendix is non-compressible, and usually inflammation is seen around the appendix in the form of hyperechoic fatty infiltration. Normal appendix is usually mobile, while the inflamed appendix is fixed in location. Now we will discuss the different stages in the form of acute appendicitis, gray zone, and then appendiceal phlegmon. The symptom in acute appendicitis usually remain 1 to 3 days, and then the gray zone for 4 to 6 days. And if this is not treated, then this will lead to the appendiceal phlegmon. In acute appendicitis, there will be the severe peritonitis, and the inflamed fat will be mild, while in the gray zone, the moderate to severe peritonitis, and the ultrasound will shows the moderately inflamed fat, while on the appendiceal phlegmon stage, there would be the mild to no peritonitis, but there would be markedly inflamed fat on the CT and ultrasound. In the acute appendicitis, usually we see no mass, but in the appendiceal phlegmon, there are usually palpable masses are noted. The treatment of the acute appendicitis is the surgery, but if it is changed into the appendiceal phlegmon, then wait and see policy is better. But the some surgeons prefer to do the surgery even in the phlegmon stage. If there is appendiceal abscess, then percutaneous drainage is done in most of the cases. But if the patient is stable, and clearly the patient is improving, then wait and see policy is better. And in some cases, when there are the mostly children or the adults with the severe peritonitis, acute laparotomy is the best option. So this is a whole about the appendicitis, its diagnosis and treatment options. Thank you for watching.